Hi guys, I want to take a few minutes and talk about something that's really important and is the number one priority in all of plastic surgery, and that's safety. What I focus on in my practice is getting the maximum result I can get for everybody safely. So that has to do with things like preventing massive blood loss, preventing need for transfusion, preventing need for complications in reoperation. Along those lines, I do all my procedures in major hospitals. So why hospitals versus surgery centers? Well, the things that everybody needs to know is that in hospitals you have full resources, and in surgery centers usually they're limited. Maybe the staff is only used to doing quick, healthy patients, stuff like that. So if something goes wrong, you may get people with slow reaction times. More importantly, however, if you have a problem during surgery, which we've heard of things like patients getting breast augmentation, and the surgeon enters the chest and drops the lung. We call that a pneumothorax, and the patient's having to be transferred by ambulance to a hospital. So if a complication occurs during surgery, most of the time the patient has to be transferred to a hospital to take care of that complication. Similarly, if you have a procedure, let's say you have a breast augmentation or a tummy tuck, and later that evening you start to bleed or have problems, you have to then call 911 and be taken to a hospital to be treated because the surgery center tends to close at 5 p.m. So for all those reasons, when you're doing major procedures like that, it can be a little bit challenging to be done in a surgery center, and those are things that you have to take into consideration. Other important things, tell all my patients the risk of bleeding. It's very important to take iron before surgery to get your blood counts up. There are risks of infection. Sometimes we put drains in just to reduce the risk of complications. We can do drainless tummy tucks on anybody, but what we don't want is where the blood oozes from liposuction and those sorts of things into the area where the tummy tuck was done and prevents sealing of the layers of tissue. So the drains can help remove the blood and expedite that, and oftentimes they're only needed for a short period of time. Other important things like blood clots during surgery. So patients in my practice get a very low dose of a blood thinner prior to surgery to reduce the risk of blood clot. If you have a tummy tuck surgery that takes 6 hours, your complication rate is going to be significantly higher than the surgeon only takes 3 hours to do the same procedure, because there's going to be more blood loss, there's going to be higher rates of blood clot, higher rates of infection. Antibiotics. Patients get a dose of antibiotics before surgery. Usually that's all they need, and they don't need any afterwards as well. People with massive liposuction or those high-def tummy tuck lipo cases, they get a lot of lipo, and a lot of them need to be kept in the hospital overnight to receive fluids for the third spacing. If you think about all the patients who the fluid just sort of drains out after surgery all over the place, well, that fluid comes from their body. So they're pushing fluid out of their body into the space that liposuction was done, and so fluid's needed to replace what's lost in the terms of IV fluid and such, in addition to needing help. So those are some of the things that are really important to me. Making sure we have board certified anesthesiologists. I'm double board certified. I was board certified in general surgery. I've been used to doing big cases my entire career, doing them in major facilities. Fortunately, they give us good cosmetic rates so that we can do our patients there for no higher cost than surgery centers, where we get all the safety that the hospital can afford versus the surgery center. So those are important things to take into consideration. The last thing I'll mention is traveling surgery. We've talked about this before. If you travel for surgery, unfortunately, bleeding complications occur right away, but infection, fluid collection complications, those things tend to occur weeks later, and so you're gone out of the place where that occurs. So it's important to be able to have access to your surgeon, etc. Places in Miami, in Mexico, etc., are notorious because they're not required to carry liability insurance. So that means that if there's major complications, there is no legal recourse for the patient. So if you could have a patient death, we see Brazilian butt lift deaths, which I've touched on before, from injecting in the muscle in the butt, then there's no legal recourse whatsoever, because the attorneys in those areas know that they will not litigate the physicians, because those physicians will just close their practice and open a new one, file bankruptcy, and there's no legal recourse whatsoever. So hopefully you guys have all learned some important things today. Feel free to reach out to me if there's anything else I can help you with. Make sure that your surgeon is board certified plastic surgeon, and that they have, if they're not doing it at a major hospital, they better have privileges to do it at a major hospital. Thanks.